welcome to everybody and welcome to our head office as well, management team. And I'll hand it over to Dr. Lord now. He will do his presentation.
Thank you. Hi, everyone. I'm Kieron Lord. So as Nita's explained, I work with the company with these products. I use them in my clinic, and me and Nita started talking, and that's when we kind of put the idea of putting these webinars together, because there's a lot of salesy stuff that goes on out there, and this isn't salesy. This is just my own experiences of using these products and how I found them to work in my clinic. So thank you for spending your evening with me, or whatever time of day it is where you are. Thank you for spending the evening with us. We will try and keep this to 60 minutes. It will be impossible to cover everything in 60 minutes, but if we give you a general overview, we can always do follow-up webinars, and we can always answer any questions that you have afterwards as well. So I'm here tonight to talk about something that's really transforming the way we think about skin health and skin regeneration, and that is primarily exosomes. We're also going to talk about a few other products as well. We're going to look at the Revive NX exosomes. So these are the ones that contain the nitrogen 1, which is a patented technology, and you'll know more about that at the end of today's talk. Now, whether you're a medical or a practitioner or a non-medical practitioner, this session will give you the real insights into what you need, is how exosomes work, what they are, how to use them safely and effectively, and how they can fit seamlessly into your treatment plans for your patients or clients in your clinic. Over the next hour, we'll cover everything from science to clinical application, and even look at the business plan and the profitability of these products. Hopefully my slides have moved on. If they haven't, Nita, I'm sure, will tell me. The reason we're a little bit delayed starting was there was a little bit of a technical glitch on my side. So let's look at exosomes. What are exosomes? Exosomes are not hyaluronic acid skin boosters. And that's the first distinction I want to make really clear. They don't just hydrate, they actually work at a cellular level and communicate with the cell's mechanisms. They send signals to repair and literally teach your skin how to regenerate itself. So as we enter this new era of aesthetics, where the goal isn't to freeze and fill, as I said, it's about restoring and reviving what's lost. 2025 is all about these kinds of treatments. To achieve that, we can start with the canvas. If you think about your skin, we often go in, or in the past, it's been very much go in with fillers, go in with whatever treatments, but actually we neglect that canvas, that skin. And unless you get that right, and unless you get the collagen boosting effects in that skin, the results of any other treatment you're going to carry out are going to be quite limited. So exosomes repair the foundation. Everything else you do is on top of that. So get the foundations right using exosomes. We can then build on that, create really great structure and contouring with fillers. But the whole point is that the base is right in the first place. So think of exosomes as a go-to product for practically everyone you see in clinic, no matter what they come in with, whatever their concern may be in an aesthetics clinic. Exosomes will almost certainly have a role to play in their treatments. And once your skin starts to look healthy, everything else does too. So get the skin right, get the base layer right, everything else will fall into place. So why and how can we achieve these undetectable results? To achieve truly undetectable results, you have to start by focusing on skin restoration rather than correction. Most clients come in wanting to smooth lines or tighten skin, but they're just symptoms. And the problem is it's a cellular damage, a cellular problem. As we age, our DNA accumulates mutations, our mitochondria become less efficient, and the cellular processes start to slow down. So yes, we can use toxins to relax muscles. Yes, we can use fillers to revolumize, but unless we're actually influencing those cellular mechanics, we're kind of fighting a losing battle. So the problem really there is we need to address the cellular damage, the inflammation, and think about the skin barrier and how to improve that. So the difference with exosomes is that they actually reverse the root cause of the problem. They're not just treating the symptoms. So those of you in the clinic who've probably had, in the talk, who have in your clinic certain treatments like skin boosters and things, you probably see that there are results you can achieve that look great over a period of time. And then 3 months later and 6 months later, you're kind of back to square one. I use skin boosters in my clinic. There's lots of really good skin boosters out there, but they're essentially just hydrating. They're doing nothing in terms of anti-aging. They're doing very little in terms of collagen production. And so actually you're not halting any of the aging processes that are going on with the cells. And that's where the exosomes come in. Are they? Because this is something, they're a buzzword. Everyone's heard of exosomes because it's all over Instagram and TikTok and things like that. And every clinic seems to have them. What are they and why does it in an aesthetics clinic? Like little delivery, not have a function in communicating between one cell and another. So a really good example is if you get a cough or a cold or a sore throat as we get into winter, when a cell in your throat is infected by a virus, it will send out a messenger in the form of an exosome to surrounding cells to explain to those cells, look, I'm infected, I've got a virus on board. It's too late for me, but you guys can put up your defenses so that you don't become infected. That's essentially what an exosome is. It's a little lipid envelope made of the same things as your cell membrane. When your cell makes a message, it pinches off a bit of this lipid membrane, and that acts as the envelope which travels to the next cell and delivers the information. We've basically, let's say we, I'm not taking credit for this, clever people have hijacked this mechanism and given the message that we want it to have. So rather than we're infected with a virus or whatever it might be, it's an actually let's improve collagen production, let's switch on fibroblasts, let's think about elastin, let's build the skin's barrier, let's hydrate the skin. So that's essentially what an exosome is. As I said, they've been around for years. No one really knew what they were, but now we actually understand them and we understand the cellular mechanics behind it. We can actually start doing some really interesting and really regenerative things with these exosomes. They can improve things like sun damage, fine lines and wrinkles, scarring, overall skin tone and texture, and all without the risks of associated more invasive treatments. Now, there are different types of exosomes on the market. I'm not going to talk about different brands today, but what I want you to understand is which brands work well and which ones, which types of things work well, which types of things don't work well, and it's all based on the where they come from. And if you understand where they come from, you understand why they work better than others. So, not all exosomes are made the same. There are three main types, four main types probably. There are plant-derived. So these are derived from plant cells. They have DNA from plant cells in there, and they provide the messenger molecule to tell your cells what to do. We have animal-based, which is often bovine colostrum, so bovine milk derived. So again, these contain animal DNA, no human DNA, and again, they carry the message. We have human-derived. Human-derived are slightly controversial in that there's some ethical considerations around them. And these are ones that have been basically taken from a human cell, switched around, and then built in a lab and remade to look exactly the same, and then put back into the body. They are allowed for use in certain countries. There are some ethical considerations with them. There's also a higher risk with human-derived of having immune reactions to them. And then finally, we have bacterial-derived exosomes, which are what we use in Revive NX. They come from a lactobacillus that normally lives on our body. You probably know this. If you don't, then there's a interesting fact that we basically have, I don't know how many times more cells in and on our body that are not our own than are our own, because we have so many bacterium and things that live in our bodies, in our gut, on our skin, in our eyelashes, that live as they call the commensal. So they basically live as part of our body. They get stuff from us and we get stuff from them. A lot of our serotonin that's produced in our body isn't actually produced by us. It's produced in the gut by gut bacteria. About 90% of it is produced by gut bacteria, and we use it. So it's a symbiotic relationship. We get something out of it, the bacteria gets something out of it. So keeping all that in mind, what are you looking for when you're looking for an exosome? I've got a really good friend called Sandy. I work on a project with her called Talking Longevity. It's a longevity clinic. And she explained exosomes to me perfectly because I struggled when I first started using them. She said to me, if you look at an exosome, it's a messenger. So it's all about the language that they're speaking. If you are having a human derived, that's like me sitting with any one of you and having a one-to-one conversation. I'll understand it perfectly. If we're speaking the same language, I'll understand exactly what you're saying to me. If I'm using bovine derived or animal derived, it's similar in that those genetics are probably quite similar to us, but there's still bits missing that don't make the same, that aren't the same as us. So she explains that as if you were having a conversation with somebody, if you're an English speaker, having a conversation with somebody, maybe they speak French. You might have done GCSE French, you might be able to pick up every third word and maybe follow the conversation, but it's going to be tricky. Plant derived is very far away from human DNA. And so that, as Sandy puts that across, is that's very much like if you don't speak Chinese, but you're speaking to somebody who's a Chinese speaker, you're really, really going to struggle to understand that message. And where bacterial comes in, and my understanding of this, and this took me a little while, when I first started working with the company, I said, I don't understand the bacterial derived element. Like, what do you mean? These bacteria are commensals. They live on our skin. We have a symbiotic relationship with these bacteria. They send messages to us all the time, and we send messages back. So we understand each other. And it's as close as I imagine we can get to doing human derived, but without the ethical implications and without the risks associated with immune reactions. So I hope that makes sense about what the different types of exosomes. So when you're looking for an exosome, remember, it's all about the message. You want to make sure you're going to understand the message, and that's how you pick which exosomes work best. Right. So let's talk about how we actually apply the exosomes, because that's what you all want to know. The sort of hero modality with exosomes is microneedling. Exosomes are nanoparticles. They're very, very small. You do not have to, and you can't in the UK. I know we've got people joining from other countries. You can't inject them in the UK. And there's no need to. Microneedling works brilliantly. Microneedling alone increases collagen production by hundreds of times, or hundreds of percentage. If you add in exosome, that is essentially turbocharged. Those exosomes will get to where they need to be purely by microneedling. It's much more comfortable for the client or patient. It's much less likely to cause trauma and bleeding and bruising, and your client's very happy at the end of the day. When you microneedle, you're essentially creating a controlled micro trauma. So very, very small parts of the skin are injured with a small microneedle, and the skin naturally releases its own exosomes as part of that process. It starts the healing process. By applying topical exosomes over the top, you're amplifying that reaction. And it's like giving the skin an extra boost of its own repair system. So you're causing micro trauma and stimulating your body or asking your body to make more collagen and repair itself. It does this by activating fibroblast cells, which are deep in the skin. Fibroblast cells start to become senescent and start to turn off and go dormant or hibernate from around the age of 25. From the age of 25, we lose 1.5 to 2% of our collagen every single year. When we hit menopause, in the first 5 years of menopause, you lose 30% in the remaining collagen. So it's really important to not just treat the cause of it, because if you think these cells start to switch off, it's hard to wake them back up again. Whereas if we can start implementing preventative strategies in our clinics where we can think, actually, we know you're going to start losing collagen. We know that 30% in the menopausal phase is really tricky. There's not a lot I can do to stop that. What I can do, however, is in the years leading up to that, bank as much collagen as possible so that when you lose that 30%, you can kind of afford to do that. And that's where the microneedling with exosomes comes in. You can use radio frequency microneedling, particularly for advanced practitioners. It adds a thermal component, which does help with tightening. It does increase, but it does increase the downtime. I personally prefer standard microneedling. I think you get just as good a results. For the practitioner, less expensive in terms of the kit and less downtime for the clients. The there are mesotherapy options, but it depends on the country and things you're in for injectable. So we'll skip that other to say you can use mesotherapy nappage with these products. The exosome can be reconstituted in water and delivered via sort of mesotherapy nappage mechanism. Again, not my preferred option. I think you get very good results with microneedling, so I don't think there's any need necessarily for that. Right then, so a little bit about who's behind Revive NX. I don't work for Revive NX. I use Revive NX in my clinic. I like them. The products are very good. The team are brilliant, and this is why we put this together. But I'm not here as a salesperson, so I'll anything I'm telling you is just based on my own experiences. The Revive NX exosomes are manufactured by Char Meditech, which is one of South Korea's largest pharmaceutical biotech companies. This isn't a cosmetic company or a new cosmetic startup company. This is a pharmaceutical giant in Korea, essentially. They produce raw ingredients for some of the biggest names in medicine worldwide, and they operate their own medical universities and research centers. Char Meditech are innovators and leaders, and they hold a patent for something called nitrogen-1. This is a molecule that's included in the Revive NX exosomes that is essentially a molecular glue. It binds collagen and structural proteins and enhances skin. As I said, I'm not here as a sales rep for Char Meditech. I'm here because I believe in the products. But they are a really great company to work with, and I've really enjoyed my time sort of doing these things and putting these events on. So let's unpick what makes Revive NX so special scientifically. We've kind of alluded to a few bits now, but one thing is the number of exosomes in each vial. The number of exosomes in the vial directly correlates to the results you're going to see, because the more exosomes, the more messenger molecules, the more cells it can influence, the more chance you've got of seeing results. Each vial of Revive NX contains 150 billion exosomes, and that's several times more than any other product on the market. They usually are around the 20 to 40 billion mark. They're bacterial-derived, so production is scalable, clean, consistent, and also there are the other benefits that I've already mentioned, which is that it's a symbiotic relationship with that bacteria in our cells. So those messages should be interpreted correctly, and there's a reduced risk of immune reactions. Because they're free of human or animal tissue, there's no ethical concerns, no immune reaction risk, and they integrate naturally into the skin's biology, supporting cell communication, repair, and collagen production. And remember that nitrogen-1, that is really the hero product in these exosomes. It is exclusive to these exosomes, and it works by enhancing collagen synthesis. So when you're applying Revive NX exosomes, you're not just improving hydration or improving things temporarily. You genuinely are improving the skin structure, the skin scaffolding, that collagen matrix that's ever so important for aging. We're supporting that and making sure that as we age, our collagen is still being produced, so our skin looks as good as it possibly can. So one of the common questions that comes up a lot of the time, whenever I do a video on Instagram or on TikTok or I do these webinars, there's the question of do exosomes cause cancer? And the answer is absolutely not. And let me give you a simple analogy about this. Imagine fresh orange juice, healthy, full of vitamins. That's what healthy exosomes are. Now imagine orange juice squeezed from rotten fruit. That's what cancer exosomes are. Every single cell in our body produces exosomes. The message is what's important. The exosome is the envelope. The message inside it is what's important. If we have a cancer cell in our body that's producing exosomes and telling other cells that that cell has been due to pathology and disease processes, that cell is no longer doing the healthy things it should be doing. So the messages it's putting out there aren't very good. So those ones are damaging. However, the messages that we have designed, I keep saying we as if I've got anything to do with it. The messages that clever people have created in a lab and told the cells what to do aren't telling your cells to produce cancer cells. It's telling your cells to regenerate themselves. It's telling your cells to produce collagen, elastin, etc. So if you hear that, if you worry about that, or if you have a client who asks, then hopefully now you can answer them and put the mind at rest, at ease. So let's look at how Revive NX stacks up against some of the other brands. Again, I tend to stay away from referencing brands. I tend to speak more about the evidence behind different things, and then you can make your own minds up on brands. Most other exosomes on the market are either human-derived or animal-derived. Human-derived often from fat cells or umbilical tissue, and they're not approved for cosmetic use in the UK or the EU. The animal-derived ones are, but we've already looked at some of the potential issues there. And in contrast to this, the Revive NX exosomes are bacterial-derived. As we've said, there's less ethical considerations there. It's fully compliant and completely transparent product pathway or production line. Each vial contains 150 billion exosomes, which, as you can see, if I moved out of the way, is way more than most market leaders. And it includes the nitrogen one for this superior collagen synthesis. When you're using Revive NX, you're using a product that's ethical, it's insurable, and it's scientifically validated. So you don't have to worry about the ethical side of things with the Revive NX. You don't have to worry about not being insured because it's a product that is easily insurable in the UK, and it's scientifically validated. I've told you the reasons behind this. I've explained that this company is, one of the leading companies doing these sorts of things in the world. They are very responsible manufacturers. They are very transparent. When I first signed up, I got sent all sorts of paperwork about the product and kind of the evidence behind it and the third-party testing and whatever else. So you're getting a product that actually works. And I think what people don't like when they come to a clinic is having a treatment, spend a lot of money on something that doesn't work, and then they get upset and then they never come back. So if you can use a product like this that you can show has, and we'll see in a minute, some of the results are amazing, your client's going to be happy and they'll come back time and time again. Right. So have I moved on? Yeah, I've moved on. That's it. Yeah. Yeah, it just looks the same, that slide, doesn't it? So when we look at this side-by-side comparison, it really does highlight why Revive NX stands apart. I'm really in the wrong place here. I can't move, I'm sorry. First, ours are bacterial-derived, as I mentioned. This means they're highly compatible with skin biology and compliant with UK and EU regulations. Many other brands, particularly those that are human, fat, or umbilical derived, are not compliant. People may use them, but they're not legal. Some even label themselves as plant-based when they're not. So you really have to ask when you're buying a product, not just exosomes, by the way, any product, really ask the manufacturers where it's from and get the evidence. And if they give you a woolly answer, or they just, it's just they check. It's probably not what it says it is. Second is the concentration, and we've discussed it's 150 billion exosomes per vial compared to the 20 to 40 billion in a normal vial. Third is the unique ingredients, including the nitrogen one, which is patented. And to that, it's a full transparency, insurance recognition, and soon to be FDA approved for microneedling in the US that makes this stand apart. So how are these exosomes actually made? Let's have a little look at behind the scenes and what happens. So, sorry, my slides are playing up a little bit on my screen. I hope it's moved on okay for you guys. If anything happens, Nita, please let me know. So here's a simple breakdown of the two main production routes. Bacterially derived, like Revive NX, uses lactobacillus bacteria. This is a bacteria that naturally lives on our skin and in our bodies. And these cells are cultured safely, purified, and then the exosomes are harvested and used for treatments. No ethical concerns, no immune risk, and full traceability. Now, if we compare that to human-derived exosomes, which come from adipose or umbilical tissue, these raise big ethical and regulatory concerns. They can't be insured in the UK, they don't have CPNP marking, and there's no chain of accountability for tissue sourcing. So bacterial derived means you're compliant, transparent, and scalable, and it means that you can answer your clients very honestly when they ask where it comes from. The production process is incredibly refined. The guys over at Child Meditech start by culturing the bacterium in a controlled laboratory. The bacteria multiply rapidly, and once the culture reaches the desired density, the exosomes are then released, and that they release are harvested.
Sorry, Kieron. I think
Yeah.
we're one slide behind you.
Ah, yeah. Sorry, it went really, really strange. This. Sorry.
It's all right. I
Let
think
me.
it's the slide.
I've just worked out how to move myself though. I can move myself now. Look at that. Sorry. Let me see where I am. Sorry.
So it's just probably the next one on.
There
That's
we go. Yeah. Are you on it now?
all good.
Is that on? Yeah. Sorry about that, everyone. I'm having like I said, I had technical issues when I logged in. Once these cultures reaches the desired density of a certain number of bacteria, then the exosomes are harvested. They're then purified and filtered to remove any remaining proteins and contaminants. And then each batch goes through strict quality control testing. Particle size, concentration, sterility, purity, etc., are all verified before it's released for us to use. And finally, the exosomes are freeze-dried rather than pre-mixed, which keeps them potent and stable until you're ready to use them. So it comes as 2 vials, and you reconstitute at the time of use, which keeps them much fresher. So this guarantees you're going to get consistency and maximum activity for every single time, every single vial you use.
Are you there? We've lost you. I think it's frozen screen now.
And the industry as a whole is seeing this, that we're seeing clients really taking regenerative skincare at home sensibly. Sorry. Exosome treatments don't just stop your clients leave the clinic. They continue with products that reinforce those cellular repair pathways when they're at home. I tell my clients, what I do is 10% of the work. The 90% is what you're doing when you're at home. And this is where the at-home products seem to work. The key players are things like the epidermal growth factors, peptides, vitamins, and obviously things like SPF. Daily use of the Revive NX home care line alongside having those treatments shows dramatic improvements in up to in as little as 3 weeks. Think of home care as part of the treatment plan. It's not an upsell. I think I used to always feel really bad about that. I feel like I'm trying to sell something, and you're not. You're basically saying to the clients, you're going to get better results by doing this. And actually, if you're somebody like me who used to feel nervous, I've come from an NHS hospital background, and I'm not a salesperson. I used to feel very guilty about selling things to clients. And actually, turns out they want to spend their money on looking good. They want to spend money with you to get results that they want. What they don't like doing is spending money in shops on things that claim to do certain things and they don't do anything. That's when they feel ripped off. Whereas actually, if you're providing evidence-based treatments they can use at home, they're very happy to spend that money with you guys. So yeah, with any treatment, think about home care and also think about downtime. After microneedling with exosomes, downtime, most clients experience, I reckon, about 3 to 4 to 5 days, depending on the depth of microneedling. If you do medical grade microneedling, really trying to get on top of some pigmentation, maybe a bit more, but usually 3, 4, 5 days. With exosomes, I've seen results in under 24 hours. They're back to the normal selves, even with a deep microneedling session. So your clients are very happy because they might have had microneedling before and felt they've had to hide. They have met exosomes and they're back to the normal self the next day and feel great about it. Some do recover quicker, some recover slower. It really is client dependent, but always obviously discuss this up front and make sure the clients are aware that there is a downtime. So not to have it the day before they go to a wedding, not to have it if they've got an important meeting at work the following day. And we do provide, or the team provide, fully loaded consent forms in the training portal, which you can personalize for your clinic. So this can all be included in the consent so the clients are aware of what they're consenting to. So let's move on now to a little bit more practical stuff, which is what you guys, I'm sure, are all keen to look at. So let's look at some of these before and after. So What I want to do now is look at the real world impact of some of these treatments. Exosomes change the way the skin behaves. Always remember this. My background is in biochemistry and biomedical science before I became a doctor. So I really like the cellular signaling pathways. And this is what we're doing now. We're actually understanding the cellular signaling pathways associated with skin aging. And we're able to influence those reactions. So exosomes change the way the skin behaves. It's not just about the way it looks and giving you a bit of a hydrated glow. We're seeing measurable improvements in structure, elasticity, and resilience, and in many cases, these can reduce redness, regulate pigmentation, and even improve the skin's barrier. What this means for you as practitioners is more consistent outcomes, happier clients, and a stronger word of mouth. They will go to their friends and say, "Look at this! I've had this great this great skin treatment at this place. You need to go and book in." And the thing with exosomes is that they complement almost every other treatment. I think I mentioned this at the start. There's not many people that wouldn't suit exosomes, and they're always going to help the clients out. They're always going to look better after having them. So let me show you some of these real world outcomes. Okay, so first of all, this is Stephen. Steve. He's a bodybuilder. He's one of the people in the company knows Steve, and so he had some treatments. He's a bodybuilder. He has extremely low body fat, and he actually suffered with shingles, sort of periorbital shingles during COVID time lockdown, and this was misdiagnosed, as is often the case. And in fact, we've got a closer at one somewhere. So here you can see it better here. Misdiagnosed for several days and weeks, and so the shingles virus became worse and started to affect his eye. He then relapsed at one point and had a flare on the opposite side. But then they originally treated him with a collagen stimulator and minimal dermal filler to sort of repair the skin. So if we look at this, so here they are, the comparison ones. So after he had his shingles flare, he recovered, but he had a lot of volume loss in the face. I keep pointing at things with my mouse and realize you can't see what I'm pointing at. He had a lot of inflammation and redness in the skin. He'd lost volume in the cheeks due to this inflammation, and also the fact that he had low fat content anyway doesn't help. And he was really self-conscious about nasolabial folds. So when Steve returned to work, he worked in quite a male-dominated place, and you know what people can be like, and having a few digs, but actually they were starting to bother him. So he came in, and I'm sat in the wrong. In fact, no, I'm going to move myself. Hold on. There we go. So he came in. He was self-conscious about this split in his malar fat pads, self-conscious about these nasolabial folds, and he still has some residual inflammation in the face. He had a combined treatment with Revive NX exosomes, a collagen stimulator, which we'll talk about shortly, and just a very small amount of dermal filler, which is Hyphilia, which you'll see shortly. And we've gone from this to this to this within this. These pictures were a week apart. So, well, the second one, I keep pointing again, sorry. The second one and the third one, photographs are a week apart following exosomes. So they genuinely can be life-changing for your clients. And these are results that will continue to improve with recurrent treatments. You're going to keep giving that message to regenerate and revive. Here are some other results. So these are examples courtesy of Dr. Oksana. This is one of Revive NX's or Char Meditech EU partners. So I'm now in the wrong place again. So the image on your left is with 2 sessions of microneedling with exosomes, and you can see there's such a dramatic improvement in skin tone and texture and pigmentation after just 2 treatments. The middle, or the second image, sorry, along there, the 3 images, shows radiofrequency microneedling using exosomes and to improve pigmentation. This is after a series of treatments. You can see that pigmentation has really reduced, and there's a small amount left to be treated. The next image is neck rejuvenation which again shows, I'm going to move myself, I think I'm all right there actually, that shows the skin after only 2 sessions, the difference between the neck and the above picture and the below picture is just after 2 sessions. And then there's also a case here, which actually isn't something that is publicized or this isn't the indication for it, but this is using the exosomes to treat pigmentation as a result of vitiligo. And this is after just 1 treatment, and you can see that the pigmentation has started to normalize. And it highlights that exosomes can regulate melanocyte activity, which is why we get the improvements in the pigmentation on the left picture, on the second to left picture, and in the vitiligo. And this is due to the exosomes modulating, whatever the word is, the MC1R receptor, which is important in production of pigmentation and melanin. So you can see here, just in these few cases, that this is a glimpse into the future of regenerative aesthetics. This isn't about freezing people's faces. This isn't about giving fake lips that look stuck on. This is about making real life-changing results for these people. That's really going to impact the way they look and the way they feel about the way they look. This is a closer-up image. So you can see this lady after the 2 sessions of microneedling. You really can see there the pigmentation changes. There is some pigmentation still there. Pigmentation, if you've ever treated it, is a really difficult thing to treat. Usually a combination of things like exosomes, microneedling, and topical skincare products to inhibit the production of melanin. But that, after just 2 treatments, is amazing. This is the radio frequency close up with the reduction in pigmentation. You can see there that age spot has significantly reduced after a single treatment. This is a close up of the neck, and you can see that crepey, dry skin that is on the top image is significantly improved by the bottom image. And that's just 2 sessions of microneedling with exosomes. So this is it. You don't need to be doing radio frequency microneedling. You can get fantastic results with a microneedling pen and exosomes. And this is the close-up of the hand with the vitiligo, which again isn't something that necessarily is sold on. However, you can see such good results, and if it can do that to something as significant as vitiligo, with general sun damage spots or estrogen or pigmentation as a result of estrogen, imagine the results you can have for your clients. So, moving on. This is how I would suggest you create a roadmap or a treatment map for your clients. Start with exosomes. 1 session per month for 5 sessions is ideal. It doesn't take very long. It's a 30-minute, less than that, 20-minute procedure with microneedling. 1 session per month for 5 months. This repairs the skin and improves its capacity to regenerate itself. Next, we can look at moving on to collagen stimulators, so restoring volume naturally. So this middle one, phase 2, is the PCL collagen stimulator, which is also produced by Meditech. There's 5 vials in here. We'll see it a little bit later as well in the talk. These stimulate your body's natural collagen production. So once we've done phase 1, which is to produce, which is to improve the skin foundations, we then want to look at the structural element of the tissues and revolumize using collagen stimulators. And finally, we can use dermal fillers like hyophilia, which are which add the finishing touches. Once you've got, I think what tends to happen is people often historically have gone, you've got volume loss in your face, you're showing signs of aging, let's put cheek fillers in. There is still a place for fillers, and the hyophilia range is really good, but it comes as part of a package. And if all you do is put fillers in, you're not stimulating collagen production, you're not addressing those skin concerns, those fine lines and wrinkles, that inflammation, what results are you expecting to achieve? So almost turn what you've been thinking of in the past on its head. Rather than go for fillers, then think about microneedling and skin boosters and whatever, get the skin right first, improve the collagen naturally using something like PCL collagen stimulators. Then after time, what do we need to do? That way, you do your little tweaks with filler. You're not adding loads of filler, which people don't want anymore. You're not adding loads of filler, and you're getting as maximum effect as you can naturally from the body's repair processes. Where you do need to add a bit of filler, often mid-cheek, That's absolutely fine, but you've done everything else first. And when it comes down to maintenance, once you've done your roadmap to your clients, you've done your 5 lots of exosomes, you've done your PCL collagen stimulation, you've added a little bit of filler. Now you've got them to where they want to be. It's just about regular small maintenance. Microneedling every 3 to 6 months, collagen stimulators 1 to 2 times a year also, and ongoing home care daily. Don't neglect the home care. It's so, so important. Right. So as we've mentioned, exosome treatment, 5 sessions, 1 per month for 5 months. The reason we space them out like this is to allow the body to repair. Remember, the reason we're using exosomes and microneedling is to create micro traumas in the skin. The exosomes then will help enhance the body's natural response to trauma, which is to repair itself. And as it repairs, it produces extracellular matrix proteins, which include collagen. Your skin regenerates every 6 weeks. In older clients, it usually goes a bit longer than that, about every 8 weeks, and it grows from the basement membrane upwards. So the skin you can see on your face now is old skin, it's dehydrated, it's keratinized. The treatments you're putting on isn't really going to touch that. What it's going to touch is the new layers coming through from the bottom. So this is why we space them out 4 to 6 weeks apart often. So we get in that cell cycle at different stages. These are your PCL biostimulators or PCL collagen stimulators. 5 sessions, again, 1 month apart. Now, application varies. You can do microneedling with this. So if it's for general all-over treatment, microneedling is fine. You can use mesotherapy, and you can also use the cannula technique. So with the cannula technique, you would mix this with water for injection, and you would fan with a cannula the areas where you're losing volume over the cheeks, over the mid-cheek, the temples, etc. And the maintenance, again, I'm sat in the wrong place. And the maintenance is once you've done your initial treatment, 1 to 2 times per year. So like with a lot of these treatments, the client responsibility to be there regularly for their treatments and the cost implications are early on. But actually, once you have done those first treatments, the maintenance is actually very easily achievable. Hyophilia, sorry, is the dermal filler range that we that Char Meditech use. It's a great filler. It enhances without overfilling and just creates really natural, nice results. You don't get a lot of puffiness, you don't get a lot of swelling that you can often get with a lot of fillers. I'm getting a little lag again. Sorry. Let me just. So hyophilia is the most advanced generation of hyaluronic acid fillers that we do use. It combines the best of monophasic and biphasic structures. Plus, it has some free hyaluronic acid in there for optimal hydration. So it means you get an instant result, an instant lift in volume. It's a nice sort of integrated filler once it's in the skin. So I do a lot of work with ultrasound, and if you see some fillers, they go in there, they look like a ball, and they stay as a ball, and they never integrate with the tissues. Whereas the hyophilia, when you scan it with an ultrasound, it's woven into the tissue, so it gives you a much more natural look and feel. No lumps, bumps, and the filler will break down naturally over time. It's also less hydrophilic, which means you get less swelling. There's nothing worse than having a week's downtime after filler because you've had a lot of swelling. And you don't need as much, because it's a nice fine product, you don't need to give as much of a force on the syringe to get the product into the skin, which allows you to be a little bit more precise when you're injecting. So yeah, great for mid-face, great for jaws, great for cheeks, and for any sculpting work you're doing. And when combined with the exosomes and collagen stimulator roadmap, it gives your clients results they will not get anywhere else. Right. What this means for you, your business, and the success as a practitioner, as an entrepreneur, as a clinic owner. You're using superior quality. So clients now are getting more and more aware of where their products are coming from. I've noticed definitely over the last 6 to 12 months, often quite misguided. However, they are doing their research, and it's often on TikTok, so they don't really know what they're asking, but they are wanting to know the information. They want to know why you're using that product, What product are you using? Is it CE marked? Is it safe? Is it, whatever? They want to know the ins and outs of it. So if you can use these sorts of products where you can tell your clients, this is why I'm using this is where I get it from, look at the evidence behind it, and also explain the science behind it, clients are sold, and they respect you, they respect the treatments, and they really do value coming to see you for their treatments. You can maximize profitability because there's lower costs without compromising on quality, as we'll see shortly when we discuss costings. And you will see increased client retention and trust, and they will refer people to come and see you because they will get the results and people will go, wow, what have you been doing? And they'll send them to your clinics. So the other thing these products are great for is that you are going to get these clients coming back regularly because it's not a one-off treatment. It's not a treatment where you say, off you go, you've had some filler, let me know when you need more. It's something they're going to have to keep up with, and they will keep up with it when they see the results. So for you, in terms of a business plan, you're getting your clients coming back time and time again, and you can get them on a membership or a subscription basis where they're paying you a monthly amount and they'll come back once every 6 months for a certain treatment. It gives you guaranteed income. It allows you to predict how much you're earning through your clinic every single month, sorry. And it also allows the clients to spread costs. So if that's something you want to look at, that's something I've done in my clinic, and it is really popular. If you think about your microneedling, you want it 4 to 6 times per year for long-term skin quality, but you might want to add in exosomes a few times with that. The PCL biostimulators, again, 1 to 2 times a year. And then home care, thinking about the growth factors and peptides from the Revive range, because this is going to be something that's going to help them see results and mean that when they come back to see you again in clinic, you're working with an even better foundation because they've been using the growth factors and peptides for the last 6 months. Why we use this approach? So why do we use the exosomes, the PCL, the fillers, and the at-home range? Well, it delivers natural-looking results, not overdone treatments. People are sick. People do not want to look overdone. One of the biggest things people say to me when they come to the clinic, if they've never had fillers before, I don't want to look fake. I don't want people to know. I don't want my husband to know I've had them done. I don't want people at work to think I look silly. I don't want people to look like I've had my lips done. And this is why the shift is moving to more regenerative aesthetics than your traditional fill and freeze. These treatments are perfect for beginners, so those who want some treatment but they don't want to change the way their face looks, they don't want to change the shape of their face, they don't want to look different, they just want to look like them but better versions of them, or them 5 or 10 years ago. This works really well. And also, because a lot of it can be done microneedling, it feels less invasive, it is less invasive. And if they've never sat in a chair and had any treatment before, they're much more likely to have microneedling than they are to go straight for dermal fillers or whatever it might be. And when they see the results, this will encourage trust and long-term client retention. They'll see the results that you've offered them. They listen to what you tell them. They understand the science behind it because you've explained it to them. They really do buy into the treatment then, and they go, well, this person knows what they're talking about. I'm never going to go anywhere else. Right. Let's look at the application protocols. So for Revive NX, these are the exosomes. Protocol 1 is straightforward microneedling with exosomes. This will stimulate collagen and enhance skin regeneration. You have 2 vials. One's a powder, one's a liquid. You mix them at the time of application and apply as a glide serum on the cleansed skin. So you cleanse the skin, you apply the vials, which you've now combined, onto the skin and use that as a glide for microneedling. You apply any remaining serum afterwards with a gauze, and you can apply a mask, a Revive mask afterwards to really amplify those results. You can also add it with things like red light therapy, which really does turbocharge. What I would be very careful of with any exosome treatments is not to use any acids. I know some companies come with peels. Some microneedling companies recommend you do a microneedling session, then follow it with a peel. Remember, these are biologically active molecules. These are proteins. If you add an acid on them, it will denature them. So don't use any acids or peels following the exosome treatment. Mesotherapy. If you're using a mesotherapy protocol for your Revive NX exosomes, don't mix the vials. Vial 1 must be mixed only with injection water, and vial 2 will be applied as a mask with gauze afterwards. And then there's a specific protocol for eyes. And again, I'm in the wrong place. There's a specific protocol for eyes, which is vial 1 mixed with water for injection, and use a mesotherapy application. So 1 ml or 0.5 ml per eye, using an insulin syringe with a needle, and that's how you apply it to the eye area. Right, I've spoken at you all now for however long, so it's Q&A time. Are there any questions? I don't know if I can see a chat. Oh, I can see a chat, so feel free to ask away if you've got any questions. I'll pop them in the chat and I'll answer them, and then we'll move on to the next one.
Fantastic. Thank you, Kieron. Dr. Lord, you can unmute your cameras, unmute if you want to ask direct questions, or pop it into the chat, whichever you're comfortable. We'll give it 5 minutes if that's okay. So any questions coming through? Are you all shy? Ask away, please.
I think I've sat and spoke at you all for the last 35, 40 minutes, whatever it is. Really informative. Thank you. No problem at all. What we'll do then is, because I know we've only got a few slides left, and I know we're getting close to time, I will continue, but please feel free to put questions in the chat. Oh, here we go. Is this £85 before VAT or including VAT? And what is the marketing support provided? Will we get B&A photos, etc.?
Yes. Yeah. So the £85 is inclusive at the moment, so it's not VAT-able at the moment. So that's the complete price. Marketing support, we do have photos, and we do have ongoing clinical studies that we're producing for real life results, which will keep drip feeding onto our portal if you do the training. So you can just access those resources there, and we will send you all the product photo, high resolution, and any of the work that we do will be available on a Google Drive link that you can keep in touch with me, and I'll send it over to you. I must mention Dr. Lord is conducting his own clinical studies as well, so we're looking forward to his results. Please bear with us because Exosomes is newly launched in the UK. We've got clinical results from Korea, but we'd like to also look at the varied type of skin types over here as well, and the response to our clinical studies. So Dr. Lord is conducting these, and we'll be drip feeding them in as we get the results.
We're also looking at the application for hair, aren't we? So
yes, so that's quite exciting. Thank you. The hair exosomes are coming out. Well, they're out now, and they combine polynucleotides. We've got our webinar with Dr. Lord coming up for that as well, which is a must join for that one. Oh yes, hair. So
brilliant. My colleague who works in my clinic sometimes, Dr. Kai, she does a lot of hair restoration stuff. She's really good at it. She gets some fantastic results. So between us, we're going to trial the hair and skin and get some clinical studies done to see how it works. But yeah, you'll be amazed at the results you can get from exosomes on the scalp.
Just to answer that question, yes, is that it will be our Revive NX bacterially based combined with PN polynucleotides and a super formula specifically for the scalp and hair restoration. And that's going to have our nitrogen one in it as well.
And that's really important with it combining polynucleotides, because if you're doing hair restoration, there's basically 3 treatments that all work really well. One's PRP, one is exosomes, one is polynucleotides. And if you can afford it, if a client can afford it, you would throw all 3 at them because you get fantastic results, but it gets expensive. Whereas if you've got a combination exosome polynucleotide product, you're getting 2 of the 3 things straight away. So I just want to answer a couple of these, and then somebody asked in-depth protocol for PCL, and Nita, can you send some further info on the products, please? The protocol for the PCL is there's 5 vials in there. You mix 1 vial with water for injection, and it's a treatment that you have once a month for the first 5 months. You can microneedle, you can mesotherapy. But cannula approach works really well as well. If you're trying to volumize the face and give a natural lift, cannula technique works really well because you're going to be able to go in and cannula up to the temples, across the cheeks, and volumize the cheeks here. So if you're one of them people who have the accordion lines when you smile because there's a loss of volume there, you really do struggle to treat those because if you put filler in, it doesn't work. But you can cannula into those areas to revolumize. will the slides be available to look back on for reference? Nita, can we send something out to these guys? Is it something we'll send out an information pack or something?
Absolutely. What I'm going to do is we will have this available in a private link for everyone that joined. And I'll give you that on a YouTube link. So what I'll do is I'll email everybody with the resources for the CPD opportunity. So that's all in the portal. Depending on how far your insurance is, like if you're medically qualified, you may have further freedom to use different depths of microneedling. So that is all on the portal for you to use. Obviously, it's not the same for scalp and hair protocol, but please hold on for the Dr. Lord's webinar for our scalp and hair. That's in December, that one. But next month, we're covering the polynucleotides combining with microneedling. So, sorry, combined with the exosomes. So that'd be really good. In terms of the CPD opportunities, you make a product purchase, and then once I see that come through, I will enroll you to the course for free, and then that will give you all the protocols and revisit some of Dr. Lord's concepts today. However, Dr. Lord has covered a lot more than the portal, so this is a really valuable webinar. So when it comes to the depth, that'll be on depth of the microneedling, that'll be on the portal.
There's a lot of information on there, and we're very happy for you to contact us afterwards and ask any question, but it's all on there. It's a lot to fit in an hour, this. So, but yeah, have a look and then feel free to come back to us if you have any other questions. Similarly, with the clinical studies, somebody's asking about clinical study results. We have clients who may want to see them, and believe that clinical studies are available on the portal as well. Is that right?
I will be posting them, drip feeding them as we get our results on the portal. So probably it's better to contact me, and I can give you a Google Drive link so that it's not too much on the portal. So that's fine. And all of your studies will put onto there as well. So
yeah, there's a question on here, Nita, and you'll be able to answer me because I'll tell you what I do, but it may from a legal point of view. The question is about exosomes on patients who have had cancer but are in remission. Do you have what's the legal side of that?
well, we normally ask for consultant clearance for any treatments like that. I mean, we're treating healthy skin cells. We're hoping that the cancer cells, once they're in remission, they have been removed or treated or cured. And so we're only multiplying healthy cells. Our derivative is from a healthy source. It's not from a cancer source. And so it goes back to what you said earlier. The messaging is the same. However, I would definitely get the client to sign off that they're allowed to do that and refer them back to their consultant. We can only work within our scope, you know.
Yeah, exactly. That's what I tend to do. So I have a conversation with the clients and sort of explain what's going on, and I go, this treatment does not cause cancer. What this treatment does is stimulates collagen production and alters cellular mechanics. My slight reservation with it is that if someone's had recent cancer, could I have any impact on their treatment or ongoing whatever? So I'd absolutely, if they still want to go ahead, I'd be speaking, say, you need to go to the consultant and get me a letter to say you can have it. But I think that's the same with most things. I did that recently with weight loss jabs and things like that. So yeah, just be safe. The last thing you want to do is cause harm. So be safe.
I agree with you, Dr. Lord. I think at the end of the day, if you're not sure, don't. So don't put yourself as a business in front of problems. We would always ask for that clearance. And if you're not sure, I mean, if it's long-term remission, we're in a different zone, especially with the early remission. Err on the side of caution, not because of the exosomes, but because it's a very sensitive time for someone in their life. And if anything, you don't want to put yourself in front of problems where something else has happened, but they blame it on you. And so we would be handled that with a lot of sensitivity and clearance from their consultant.
Yeah, there's all sorts of things. I don't know who's on the group who are medical, non-medical, things like that. But there's loads of things, if somebody's got a recent cancer treatment and they're still on something, which can happen for years afterwards, it can reduce their immune system a little bit. So then you may find that you're at increased risk of infections. And so there's a lot of stuff to it. So that's why it's worth pass it back to the specialist, let them confirm it. If it's fine, they'll come back to you. Somebody's asked about depth of microneedling. That really does depend on what you're treating and where you're treating it and what you're trying to achieve. There's different depths for different parts of the face, the different depth for different parts of the body, the different depth if you're trying to do pigmentation. different depths you're allowed to do if you're medical or not medical. So the depths really, the depth isn't influenced by the exosomes. The depth is influenced by what you're trying to treat and what you're trying to achieve.
Yeah, so we've got a table on the portal for the training for the depths, and it's mostly covering cosmetic, which in the UK for the face is up to 1.5, and on the body can be 2 for cosmetic aestheticians. For medical is deeper, but you would have to check your insurance. So there is a guidance chart. It's not you would microneedle as you usually microneedle. We're just using the exosome product.
Yeah. Yeah. So yeah, that's it. It's not influenced by the exosome. Do as you normally would do. And you get some fantastic results without having to go medical grade depths. But if you are somebody who uses medical grade microneedling, you'll see that the recovery time is significantly improved with exosomes. So if you do medical grade microneedling, it's the one where you get quite a bit of blood and it looks quite traumatic. They look, they do look like they've got a bad sunburn. You apply the exosomes, within a day or so, they're back to normal. Whereas traditionally, they've had a week or so downtime because it can be quite brutal for real deep medical microneedling. So yeah, they work really well. Right, let's have a little move forward. We've only got a few slides left, and I'm conscious I've kept you all over the allocated time. If you do have any other questions, write them in the chat for us. So this has already been covered because somebody asked this. So yeah, cost-wise, cost per set is £85, inclusive of VAT. That is for your set to treat a client. Depending on where you're based, you can charge a lot for this treatment. So I know London prices are always a little bit more than everywhere else, but London prices exosome microneedling around £400, £450 a session. I'm in Manchester, very, not a million miles away from that. And it is something different, and it is something premium, and it is, the leading or one of the leading exosome products out there. So you should be charging more for it because you can say why that is. So actually, the return on investment for you guys is really good. And remember, the way you can do that over a membership or a subscription plan, you've got ongoing income. You do have with Revive and X certified training and support. Nita's already mentioned. I think we've covered quite a lot of this already in the chat, actually. But so there is the portal with the online information, online training resources. Nita will happily send you out any clinical trials that you want to have a look at as well. And once I've got mine up and running, I'll speak to Nita about getting on the portal or sending it out to you all so you can actually see some of the real life results that we managed to achieve. This is one of the partner insurers, so Beauty Insured. So if your insurance company, you've either got an insurance company and they're not covering for whatever reason, or you're moving insurance company, or you're just starting out in aesthetics and you're looking for insurance, have a look at Beauty Insured. They will give you the contact details are all there for Laura, and they will give you the I need to go back one. Someone wants something being showed. Here you go. I'll put myself in the middle so I'm out of the way.
Should I explain this? If you don't, should I?
Yeah, go ahead.
Okay, so it's just all our practitioners that have done our CPD online portal training will get an authorized Revive and X practitioner ID with their with the online certificate. We don't send out a physical one, but what we're doing is we're celebrating our businesses as well. So when you get your great work, please tag our brand and we'll share your work and showcase it so it helps your algorithms and helps us as well. You will have a lifetime access so you can refer back. So when the protocols are updated, for example, we are probably only going to be sticking to microneedling going forward. That's going to be updated onto the portal. And then we will give you the Google Drive links. I think I'll add those Google Drive links onto the portal so that you can got your high resolution product photos and so the badge itself I'll send you once you've completed the 100% of the course and you have your unique ID, so you're authorized and you can showcase that on your website, on your social media, that you're authorized by our brand as our practitioner. So yeah, it's great. I mean, we normally charge $229 for the training. It's free when you buy your first exosome product, it must be exosomes, whether it be 1 set or 5 sets, you get that free. Okay, so
Thank you for that. You explain it much better than I do. There's your insurance thing, and is this what you've just discussed now, Nita?
sorry, I've got too many slides and we're just covering it quickly.
That's all right. No, it's hard to remember what's coming up here, but this is what Nita just explained now. So yeah, you got your online training, free CPD accredited training with any exosome purchase, either 1 box or the box of 5 sets. These are future upcoming webinars. So the next one is Monday the 3rd of November, and this is looking at exosomes and polynucleotides. So using the two together, you'll get some amazing results. I've been using polynucleotides longer than I've been using exosomes, and the combination of the two together works really, really well, because you're getting the best of both worlds. So come along to that. We'll talk about that. I'll have some before and afters, hopefully finalized by then. The problem with these before and afters and the trials is it takes long to get the pictures, because you want to see these treatments look great, but actually they keep getting better and better and better. Because if you think about it, if you do exosomes or polynucleotides, you're trying to stimulate those fibroblast cells. They don't just wake up, it takes time. So if you do, say, for example, a polynucleotide or an exosome treatment, I always warn clients, look, don't expect miracles within the next couple of weeks. It's going to take time. And then all of a sudden you see someone back, you've done your 5 treatments, you see them back for the maintenance treatment in 6 months, and you're like, wow, like, look at your skin, like, because it's carried on getting better. So this is why the trials take a little bit longer to get the results out, but as soon as they are, I'll show you, and if I get anything by then, I'll include them. And then on Monday the 1st of December, it's all about scalp renewal, which I think a lot of you seem to be quite interested in that. So we'll go over the scalp renewal treatments, how to use exosome microneedling for hair regeneration. This honestly is a game-changing treatment, and for those people who don't want to fly off to Turkey and get a hair transplant, you can do a lot with microneedling and exosomes to improve thinning hair, whether that's male pattern baldness, whether that's alopecia, whether that's hair loss associated with menopause. Honestly, you should see some of the results you can get with exosomes and microneedling in the scalp. So definitely one to come along to if you guys can. And here is everybody's information. These are some of our accounts. So that's obviously my Instagram up there, and that's my Instagram for training. So if you are a practitioner who is interested in training, I have a few different courses, including online mentoring programs and things like that. So even if you're not UK based or not Northwest based in England, you can always find a course there that will help you. We've got Revive NX UK and Nita's Instagram also, and you've got Charm Meditech. So give those a follow. And when you do get some results, please do tag us in them and let us see them. I think there's not enough, I'll put that there so you can see everything. I think there's not enough of kind of collabs that go on across the industry. Everyone sticks to themselves a little bit, and it's quite nice to share some of those wins. So if you do get any good results from your treatments, copy us in, tag us, send them to us, let us see them. Because yeah, it'd be really nice to actually see that what you're able to achieve is what I've told you will. I think that's probably that's the last slide, I think. Any other questions?
So if you've got some more questions, if you can drop them into the box. And I just want to say well done, everyone, to join our exosome webinar with Dr. Lord. We are so proud to have him on board and look forward to all the ongoing webinars with you, Dr. Lord. And I want to say one thing is give yourselves all a pat on the back, because 2026 is all about regenerative aesthetics and longevity. And what you're doing by attending our seminars is positioning yourself at the forefront of the industry. So well done. And you've got the 2 free webinars that we've scheduled. We've pinned Dr. Lord down. He is a busy guy. He's doing a lot of these. So we are very honoured to have him lead our exosome webinars. So make sure you join the next 2, because it's building on what we know at the moment and enhancing and helping you to stay at the forefront of aesthetics. So thank you very much. And thank you so much, Dr. Lord.
That's all right, anytime.
I mean, I learned a lot as well. So, all right. Shall we? Is there any more questions?
Just somebody asking, I was going to type back, but I'll say that. Somebody asking about, can we get the slides? I said it's being recorded, isn't it, Nita? So it'll be sent out to these people.
Yeah, it'll be it. I'll send you a YouTube link. You can watch it all again, and if there's any information you want to extract for your own marketing, please feel free to do so.
Yeah, and anything that pops in your head over the next few hours or few days, if you think back to it and go, I'm not sure about that, what did he say? Very happy for you to reach out and ask me a question. Drop me or Nita a message and we'll get back to you as soon as we can.
Okay, so I'll drop the email address. If you can drop us an email for any questions for Dr. Lord, please send them over and I will make a list and get back to everybody. I'll send it on a newsletter.
Yeah, there's just one question I want to address there, which is about insurance. Somebody's asked, if we already do microneedling, do we need to let the insurance company know we're doing exosomes? Yes, let them know. They may or may not add any charge to your insurance premium, but you need to let them know, because if you use exosomes and you get an adverse reaction for any reason, you wouldn't be covered. That's the same with any product that you use. So if you're using a product, tell the insurance company, please.
Yeah, and they can just say they're using exosomes. Ours are compliant, so ours will fit that bracket once they say yes to exosomes.
Depends on your insurance companies, but I've had some where I've added things on and they don't care. Like they need to put it on the policy, but there's no additional charge because it's the same thing, but it just needs to be covered. So just ask them.
Some insurers just insure the treatment modality. They don't mind the product that you use, but that's not that doesn't go for every insurer. So it's always better to check to keep yourself covered.
Yeah.
Yeah.
Great. Well, thank you very much, everyone. Thank you for coming along. Thanks for your kind words. And I hope it was useful for you all.
Brilliant. Thank you very much. We'll catch you all next time.
Thank you. Bye-bye.